Present a patient that had multiple hair grafts placed on his hairline, and they were placed lower than they should have been placed. And I'm going to show this video showing how we get these grafts out and how we have to be perseverant to get them out. We have to use certain techniques like suction and the proper equipment. One of the mistakes that many physicians make when they're trying to remove these grafts off a frontal hairline are they leave hair behind. And when you do, then it's going to be much harder to go back at a subsequent date and take those grafts out. I have a lot of patients coming to me after somebody tried to correct their hairline and they left a mess on the hairline. Multiple hair grafts, they come to me, I finally get them out. Now, one of the things that happens with grafting is you can kind of think that hairs grow at an angle, just like a banana. And you can see that this is a two-hair follicular unit. And it is growing at a downward angle. So you want that downward angle growing toward the skin. And one of the things that happens is individuals will place grafts on their back. It means that the assistant was never taught properly that there's only one orientation for that follicular unit. And you'll find grafts that are on their side and the hair is growing to this side. You may see grafts on the other side and it's growing at this side. You may see any multiple of angle in between where the hair is not going in the correct direction. There's only one angle that's correct. And this is one of the most important things to teach a surgical assistant, and it's the one thing that no one teaches. And the reason is simple. Doctors can't place grafts. They were never taught how to place grafts. They don't know that there is a precise way to do it. And unfortunately, their assistants are never taught properly how to do these things. So we'll watch the video and then we'll get back with you and talk a little bit about what we did and how we did it.
All right, so look, this hair, back off. This hair was coming at this direction, okay? This is his natural direction, this way, okay? So that's his natural direction that way, not this way. So that's a stick in place technique where the hairs are put in there. Now, this one, if you look at it, is growing up like that. So it's put in backwards. In other words, it's on its back. It's not angled properly. I'm gonna get him out. And so you see the curve? So this graft was laying on his back and he should have been laying on his belly like that. Should have been growing down, not up. Right? He's coming out because he's angled wrong. He's put in the wrong direction. Okay? There's a tube. That's right on the hairline. Okay? You don't want those tubes right on the hairline. There's another tube right on the hairline, right at it. Right in the middle, too. Like, you don't want to see this. That's actually 3 hairs. My goodness. Now you go right up here, right next door to it, right here. That's another one. 3 hairs. See? 3 hairs. Right in the middle. Toward the middle. You don't want to see that. Now if you take this, can you see this one?
I'm on it.
See how the hair is going back? You're going backwards. It's 2 hairs on the hairline. Okay? And we got to get them out. He's angled the wrong way. He should have been like this. So that the hair grows down. It should have been in this angle, and instead he was laying on his back. Same thing here. 2 hairs. One of them's white. You see it? You get that, Nick?
Mm-hmm.
2 hairs right on the hairline. One of them white. And also angled backward. This one right here. See how that hair is going back that way? This one's laying on its side. Now, every graft has 360-degree potential. He should have been rotated around to this direction so that it grows down. Okay, can you see, make out that curve? There's a little bit of curve there on that graft. See, that's the belly on where the curve is. This one right here. This is a nice single hair graft, but this angle right here. It's a little close to it. I don't know if I'm going to do it again because of that. Yeah, these are teals. Just a little, he's going into teal. Or he just started regrowing. Now see how this one's growing down? See that's going down? And it's a one hair graft? We can leave him. He's right. He's angled correctly. And he's not too many hairs. He's getting into the twos. We're going to leave some of the ones. We can always come back and get them later. There's twos. Two. Now the other thing we're doing is we're elevating this hairline because it's too low. The hairline is about 6.2 to 6.3 centimeters in the lateral margin, and in the midline it is 5.8. So for that reason, I need to elevate it. Now I got to go get this guy. He's a little tougher to pull. He's a two hair graft. We don't want him here. We got to elevate this hairline. So we're going to have to go up above where the current hairline is in order to rebuild a natural hairline. So this is a multiple hair graft here. I don't know how many just yet. Two. His hair is kind of coarse, so it's tricky. This is the multiple hair graft. This multiple hair.
Okay, so you've seen the video, and you see how we take out these grafts that were placed too low on a hairline, or they contain too many hairs. This type of work was done for many years. In fact, there are over 30 years of transplant repair work dating from the origin when it's first described in the literature in 1958 until the early 1990s. And until this time, the only type of work that was available were plugs, mini grafts, well, they used to call quarter grafts, which were 2 follicular units or 3 follicular units in a graft, with the possibility of scalp reductions and flaps. And flaps were hideously disfiguring. So the scalp reduction was as well. Most of the procedures were plugs. Now, the work was so bad that there were only a handful of physicians who actually wanted to be hair transplant doctors. And the field of hair restoration surgery was ridiculed. It was ridiculed on TV by shows like Seinfeld, who talked about hair plugs. And there just was no real effort to make the results better. And when patients complained about their appearance, the physician would say, "Why are you complaining? You didn't have hair and now you have hair." So that spoke volumes to the ethical level of the physicians who were offering hair restoration surgery at the time. Now, when I got into this field, the intent for me was to provide aesthetically pleasing results to all of my patients. And it was to, give these individuals who, had hideous looking transplants an option for a more natural appearance. Now, creating a more natural appearance oftentimes included having to remove the unnatural grafts that had been placed previously. So we had to come up with techniques to do this. And we were very limited in the techniques we had. So we didn't have really great techniques until 2003, when I came up with a technique to improve the excision of these grafts. And that included the use of FUE. So between 1958 and the early 1990s, there was a lot of bad hair transplant work, and most of it created repair cases. Since the mid-1990s, there's really no excuse for this type of work, but yet it still persists today. And the question is why? And the answer is that the industry as a whole created the best plastic surgery option available to patients. In other words, our hair restoration procedures were so good that even hairstylists couldn't tell that it was a hair transplant. In fact, they would argue with the patient initially. They say, it's not a hair transplant because I know what a hair transplant looks like. It's plugs, it's mini grafts, it's flaps. Sort of shot ourselves in the foot because we created such great results that all of a sudden physicians from every field of medicine wanted to add hair transplant surgery to their practice. And today we even have, psychiatrists doing hair transplants. We have physicians who are plastic surgeons who are really good plastic surgeons, but they add hair restoration surgery, and the question is why? And it's because the results are more natural, and number one, and number two, they don't realize how technically challenging the procedure is, and number three, they don't recognize that the assistants they're hiring to perform the entire procedure don't know what they're doing. And they entrust these people to locating the hairline, where are we going to place the hairline, to how we're going to harvest the grafts. They're going to harvest the grafts, the assistant, and then making the recipient sites and then placing the grafts. And so because these assistants are not properly trained, these surgeons, these plastic surgeons, these non-surgeons who all of a sudden decide they want to add hair transplant surgery, let's say, to their medical spa, begin to perform this really bad hair transplant work. And so I still see these bad low hairlines with too many hairs on the hairline, where the grafts are improperly angled, and I see them all the time. And these are performed today, since the mid-1990s. Surgeons come in, they see the procedure, and they think that the assistant just does everything. And so they may buy a machine from an instrument company, and the instrument company will provide them with assistants who come in and do the entire surgery. When you look at this procedure, it looks simple, but in fact, it requires the right tools, the right method, the right settings if you're going to do it mechanically. It requires a number of different options. And in fact, on any one of these cases, I might make a change, 5 or 6 times. I might change my depth, my settings, my punches. I might change the type or style of punch. I might change the depth on my punches. And, when I have pitted grafts, I'm going to have to approach them a little different than if I have grafts that are placed, flush with the skin. But everything has to change. And since I developed the instruments that perform these procedures, I know how to pick and choose and vary what I use. And so when you're performing these FUE extractions, where we do a plug removal and then oftentimes a redistribution of the grafts, we've got to have a lot of tools. We've got to have a lot of options, and every patient is different. A 4-hour session, I might get out 300 or 400 grafts. And then again, I might get out 100 or 120. So every case can be a little bit different. if you have the right equipment. You can predict if someone is heading to a Norwood 5 or 6. And if they're going to go to these more advanced degrees of hair loss, you can't build lower hairlines. You know, I wouldn't start lower than 8 centimeters on some of these younger patients who are headed to a Norwood 5. And, you know, we don't want to set them up for trouble in 20 or 30 years. We want to create something that's going to look good for them today and good for them as they mature. You know, the worst case scenario is to create a transplant like Joe Biden has. And Joe started out with plugs, and we helped educate the surgeon who did his original plug work into how to soften and make his hairline look more natural. And, you know, now Joe Biden has a big hole in the back of his head because he didn't do anything to help him maintain his hair. And, you know, we don't want to set patients up for that. Sometimes the best solution for patients is to say, look, you're just not a candidate for this procedure. And you may not be a candidate unless you do something or take something, some kind of medication, pharmaceutical, that will help you maintain your hair. So if we can prove that these individuals are responsive to, let's say, a pharmaceutical, then we might be able to be a little more aggressive, but certainly not very aggressive. So in this particular procedure, it looks very simple. We have to elevate the hairline, which was very low, to about 9 centimeters, and then we can come back in 3 or more months and rebuild. One of the things I tend to see is patients will come to see me after they've been through a couple of sessions, sometimes where a doctor tried to remove grafts that contain multiple hairs, or they were angled improperly, or the hairline's too low. And unfortunately, the doctors miss the grafts because sometimes they only have 1 or 2 tools. And if you only have 1 or 2 tools, it's like thinking everybody's going to fit into the same size dress or pants, and they're not. So you have to be able to mix and match to the patient. And, you know, you have to be able to look at the surface of the skin and determine what angle that graft was placed at. What angle was it rotated to? Because that's going to change your trajectory on how you proceed into the skin. And if you proceed at the wrong angle, you'll chop across the roots, and then you have to have the ability and the perseverance to go in and find those roots. And a lot of physicians don't have the equipment necessary to do that, or the training. And sometimes the graft will appear to grow in one direction and it actually grows in another due to scar tissue. You have to go find the roots and get those out. Otherwise, they have a high probability of regrowing. And now it's even more difficult to get them out because they're growing through scar tissue, which will change the direction of hair growth even more. Makes it even more tricky to get these hairs out. So that's a brief overview of what we have to do when we're removing these very unnatural grafts. It's not easy. And if you do your homework, you'll be able to find a surgeon who's skilled and adept at removing these grafts, and then can come back and rebuild a natural hairline for you. Or in some instances, you know, I have patients who have a lot of plugs on top of their head, and we go in and we just take them out and we turn them into normal bald guys. And that can oftentimes be less expensive and makes people happy. Sometimes you have people who, you know, in their 20s, they had a transplant and it looked unnatural and they're trying to hide it under hats and whatnot. And then they, you know, get married, have some kids, and they're more confident with who they are. And so we just take it out and they're normal bald guys. We don't have to worry about the progression of hair loss. They just keep losing hair over time. And they don't have to worry about what that does to the appearance of their scalp as they mature and they lose more hair, and what's left on top is grafts, especially unnatural grafts. So it's a brief overview, and hope it helps you understand better how we soften hairlines and make individuals who are unnatural in appearance look more natural. So if you enjoyed that one, we'll hopefully see you for the next one.
ForHair is run by Dr. Cole with 30 years of hair restoration experience, and we offer the most cutting-edge technology available. In fact, the ForHair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose ForHair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of ForHair's video uploads. For online consultation, click on the link on the screen or in the video description.